Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Hello, and welcome to Talking Head Pain, a podcast that confronts head pain head-on. I'm here live at the American Headache Society's scientific meeting. This is Joe Coe, and I'm here with a very special guest. Can you state your name and affiliation?
Yeah, hi, I'm Alicia Duyvejonck. I'm a nurse practitioner in Davenport, Iowa, and I run Genesis Headache Clinic.
So we're part of a really cool poster here, a research poster that we worked on and you were able to present. Can you share with our audience what the research poster was and why it matters to them?
Yeah, this was a poster called Person-Centric Communications in Migraine. This was a Delphi-Like Consensus on best practices recommendations for people with migraine and healthcare professionals.
And what did we learn from this?
Well, we were able to come together as a group. There were headache neurologists. There were a couple of headache nurse practitioners. There was a headache psychologist, as well as persons representing the advocacy community in migraine. And we were able to come together and come up with a framework of recommendations for improving migraine communication with recommendations specific to both providers and patient, including topics of understanding and awareness of migraine, practicing person-centric communication, and individualizing treatment.
So being part of this, what was interesting to me was how we use this Delphi model to build consensus and get different stakeholders. So as a patient myself and a patient organization and as a provider, how did we align and come up with best practices that we're proposing for patients and providers?
I kind of explain the Delphi process is it's like formal brainstorming, so we all come together and we just kind of talk about, well, what's important in communicating migraine? How do we do that effectively? Migraine patients on their side, what's their responsibility in the communication? And really just brainstorming, literally just writing it all out on a huge piece of paper and then altering or more specifically looking at, okay, what do all of these stakeholders have in common and feel is important? Because it's very important not only to identify what should providers be doing or what do providers think will be important in communicating migraine, but also the patient and advocacy side or the psychology side. So I think it was really important in this project that we had representation from all those stakeholders.
And what was the big takeaway?
The big takeaway was that as providers and as patients, we need to be very open in our communications. We need to do that to not only build a therapeutic relationship, decrease stigma in migraine, but also identify what best treatments would be for specific patient type. You as a migraine patient and your needs are very different than my needs as a migraine patient. And so the communication is just really, really important in a disease state that's so heterogeneous.
Totally agree. And it's just another example of how we engage in shared decision making and was really cool to be a part of. Thank you so much for your insights and for presenting the poster.
Absolutely. Thank you for the interview. And it was great working with you on the project.
Thank you for listening to this episode of Talking Head Pain, the podcast that confronts head pain head-on. If you have any questions, thoughts, or suggestions for us, you can send us an email at podcast@ghlf.org. If you enjoyed this episode, please give it an honest 5-star rating, write a positive review, and spread the word by sharing it with your friends and family. It'll help more people like you find us. I'm Joe Coe, and I will see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.